So thank you for being here. So I suppose, and I assume that the reason why we are all here gathered tonight is that because you are interested in, is this working as it should? You are interested in the brain. And actually, the brain is quite a fascinating organ. So it's just about 3 pounds, so let's say 2% of our total body weight. It's mostly composed of fat, so it's not that sexy, but it's really a very important organ, and maybe the most complicated and difficult to understand organ that we have. It's also a very demanding organ. It requires a lot of energy from our bodies. It's consuming about 20% of the energy of our whole body. It's consuming about 20% of our body oxygen. So it's really a central organ, and we need it for a large number of things. We need it to think, we need it to feel, we need it to understand, to learn, to move. So it's really a central organ. And as you probably have realized, the brain is all over the place these days. I mean, it's in the news, it's in the press. There are books, so they're even selling books like, The Brain for Dummies. So it is really something that is taking a lot of attention these days. And one of the reasons why the brain is so interesting to people now is that the neuroscience, the science of the brain, has really made large progress during this last decade. So we understand and know a little bit more about the brain, but also because we're starting to realize how important the brain is. If you remember, we've been talking about the heart for decades, and now all of a sudden the attention is on the brain. So things are developing. But really, what is brain health? And brain health refers to the ability to remember, to learn, to play, to concentrate, and maintain a clear and active mind. And it also covers being emotionally well and being in balance. So simply said, the brain health is all about making the most of your brain and helping reduce some risk to it at your age. So it is really about taking care of your brain. And my colleagues and I, we are very interested in brain health because it covers both your cognitive abilities and your mental health. And we're trying to find out how people think about the brain, because really the question is, how do you think about the brain? Is it something you think about? Are you worried about your brain? How often do you think about your brain? Are you doing anything in particular for your brain? So we are interested in all these questions, because if we understand a little bit more about how people think about their brain and what they are willing to do for their brain, maybe we will, as researchers, know what kind of guidelines and recommendations we can provide to people so that we can help them taking care of their brain. And what my colleagues and I did last year is that we had a number of interviews. So we conducted 44 interviews with people participating in brain research. And we sat around a table with them individually, and we asked them a number of questions. So we did that in Oxford, in Barcelona, in Berlin, and in Oslo. And we asked these people how they felt about the brain and brain health, whether they were interested in maintaining a good brain health. We wanted to know about their willingness to do more for their brain, if they were willing to do anything for their brain. And we also asked about the intention to maintain a good brain health and prevent brain disease development. So we were really interested in knowing whether there is this awareness of the importance of brain health. And we have a few interesting findings. Actually, we see that when people start talking about the brain and a healthy brain, they will usually use terms like functioning normally, or finding the balance in your life, or being active, or having the ability to cope, or being happy. So many of the references we received from people were references to cognitive health, so rather the ability to think and process information. Many referred to memory as an important aspect of brain health. So the focus was more on the cognitive aspect of the brain, that maybe the brain as a physical organ. But interestingly, some of our participants pinpointed that you may have a physical disability but still have a brilliant brain. And Stephen Hawking was the typical example that several of our participants gave us. So it was interesting to see that people had this understanding of the complexity. And then we also find out that actually people do not think about their brain. Not that much. So it's rather a matter of, you know, it's there. I'm just assuming that it works the way it should. I take it for granted. And some participants actually said, I just take it for granted. And they also confessed that, you know, brain health is not really something that I'm used to think about. And it's not that much, it hasn't been that much in the public discourse. But at the same time, interestingly, our participants felt that they were in control of their brain health. So it's interesting, don't think that much about it, but still feel that they're in control. Then we asked them, how would you describe the brain and how the brain ages, how the brain develops? And then we've got, you know, people are using terms like neurons, connections, plasticity, the brain shrinks, the connection changes, and then we ask a little bit more questions, and then they start feeling a bit unsure, because the mechanisms in the brain are complex, and people are not so much aware of what really happens when the brain ages. I mean, you maybe have an idea, but when you start having to describing it, it becomes much more complex and difficult. So, and then in the end, some participants just acknowledge, oh, you know, I don't know that much about what that happens with the brain, really. But I would like to know more. And then we have what we call the brain health paradox. Because when we talk to our participants, they gave us this impression that they understand that the brain is part of the body, obviously. They are quite aware of what is beneficial for the brain. And I'm not going to tell you that much because I know the other speakers will do. And we also have this survey that I will mention in a couple of minutes. So it seems that people understand that the brain is an important organ. They understand what is important for the brain, what is beneficial, but at the same time, they don't do much for their brain health. Their focus is on general health, taking care of my body, but somehow the connection between the brain, what is good for your body, and your brain health, it's not totally there. And we find this really interesting. Because what can we do as a research community to make people more aware of the importance of brain health? And then we also asked whether people would be interested in knowing more about their brain health. And we told them this story that, okay, let's imagine that there's a brain health test, something quite simple, quite easy to take. And this test can give you some information about your current brain health status, and also some information about your potential risk of developing a brain disease in the future. Is it something you would consider? Is it something you would be interested in? And we realized that many of our participants were quite positive to it, and when we have individual interviews, we have the possibility to discuss a little bit the pros and cons and what will you do it and why not. But even after some time of reflection, people were quite positive to it. They were less positive to taking a test if the test provides information about a disease that you cannot prevent or that you cannot treat. But all in all, people were quite positive to the idea. And this is also interesting because it gives us an indication of the type of tools we should provide to people. But they did put a condition, or several conditions, of course. So the test should be easy, it should be accessible, it should be something that does not require too much effort. And they also asked for some scientific evidence of the impact of doing something when you receive information about the test. Because we asked them, if a test tells you, okay, you should do more for your brain health because you're at risk and you should maybe change your lifestyle, are you willing to do something? And people in general say, yes, I would be, but I want to know that if I do something, it will have an impact. So I want the scientific evidence, and which means we have to go back to our desk and work more to provide more scientific evidence. And our participants also told us that, I know I would be struggling with the motivation to do something more for my brain health. So I really need something that triggers the motivation. And that's something we need to work with. So is it sufficient to just provide you information about what is good for your brain? Would this be sufficient for you? Or do we need to give you more than that? Do we need to give you practical tools? Do we need to give you personalized information about what is important for you specifically? This is the kind of things that we try to find out. And our participants said that we are interested in personal follow-up. So I want to know exactly for me what is important to do to maintain a good brain health. And at the same time, our participants also said, but the public health authorities have to do something about this too. And they have to, set up the right prerequisites so that people can actually take care of their brain health. And it was a bit of the carrot and stick policy. So we got a lot of ideas for what public health authorities could do, like subsidizing food that is known to be good for the brain, like fish, for instance, and cutting subsidies on meat. In many countries, just like Norway, for instance, we still have subsidies on meat production. We were discussing a little bit taxes. Should we use taxes? And people are a bit, yes, but. So yes, we like some taxes because I understand that it's good for me. But on the other side, if you put taxes on sugar, and I really like to buy candies, so finding the right balance here was seen as really important. So we learned really a lot from these interviews. It was really a wake-up call for us, I think. Now what we would like to do is to extend our sample, because we just talked to 44 participants. So we would like to hear the views from a lot more people on brain health. And as far as we know, reaching out to a very large number of people in Europe has not been done before when it comes to asking about brain health. So what we are working on is the survey that you've seen, and this is a pilot version. So basically, we are taking the questions we discussed during our interviews with participants, and we translate them into a survey, which is a really difficult task because it's much easier to talk with someone face-to-face and ask detailed questions and go in depth, etc., than having to set up smart questions and receive good answers. It's really difficult. So we have prepared this version of a survey. We plan to distribute it very largely to make it publicly available on the Lifebrain website. It will be primarily based or provided online, but we are working out trying to find out whether we can provide it in other ways as well. And we aim to translate it into 8 languages. So potentially, we could have a lot of people answering this survey. And really, the reason why we distributed it tonight is that we need, if you agree to do it, if you are willing to do it, we would very much like to receive some feedback on the survey, on its content, the way it is written, whether the questions are understandable, whether they make sense to you, whether you are missing anything, or if there is anything that you think is totally silly. Because, after some time you get blind when you work on something like this. You don't see what needs to be improved. So if you are willing to do it, if you find the time to do it, please have a look, put some marks, write big letters if something is really crazy, and leave them on the table when you leave. And this will really be very helpful for us. And hopefully, if we manage to collect all the feedback we need and really provide a good survey, it will be launched officially sometime before the summer. I don't have an exact date for that yet, but it will be available on our website. And I just wanted to introduce the team of people working on the survey. Some of the people are here tonight. So thank you so much for your attention. I hope you will enjoy the next talks. Thank you.